Hi, I'm Dr. John Young here at Foundational Health Center here in Largo, Florida, and with my nurse practitioner, Alex.
Hi guys. Today I have some questions for you, Dr. Young.
Uh-oh.
I really want to know what is the deal with corporate medicine. Now, specifically, I want to know this because recently, and I've noticed this pattern, a lot of my patients been asking me this. Why is it, Alex, that I've been seeing the specialist? I went to, the top doctor in town. I went to the top university, and I keep getting the same answer to the problem. And I'm asking for second opinions, but it doesn't seem like it matters. I always get the same prescription, or I always get the same diagnosis. So what is the deal with that? How's that has anything to do with corporate medicine?
So, a patient a couple weeks ago asked me, John, I saw my primary.
Mm-hmm.
He said, I have this, I need this medicine, this medicine, this medicine. And I tried it, didn't get any really better. So he sent me to another doctor on the 4th floor.
Okay.
I saw him on the 5th floor.
Okay.
And he told me basically the same diagnosis and gave me the same meds. And then I said, well, I'm really not happy. I went to another doctor a block away.
Yeah.
And he gave me the same thing. Because here's the thing. Everybody, well, I think, let me go back. Years ago, President Obama said, you know what? Medicine is getting very complicated.
Yes.
What we're going to do is we're going to get the smartest people. And they all seem to come from Harvard or Yale.
Yeah.
Not University of Florida or anywhere else.
Right.
We're pretty smart here. And we're going to come up with the best treatments for these conditions.
Okay.
And so what they did is they came up with the best treatments, and it's part of the AMA, American Medical Association protocol. And if you have this, you do this, 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 and this.
Mm-hmm.
And if there's a problem, you do this, this, and this. And it's, people do it, doctors do it, because if I follow the protocols, even if they don't get better, I'm probably not going to get sued, and I have nothing to worry about. The problem is our practice is filled with the 20% that never get better.
Right.
And even he was saying, it's just the same protocol, and I'm still not better.
Yeah, but there is an impression that patients getting, and I think that's a problem with algorithm. You want to make medicine simple, but it's just not. When you start thinking, you have to think to solve a lot of these problems, especially these patients that we have, because like you said, they've been to several different specialists, and you have to put a lot of thinking into that. Now, if you make an algorithm, if you make a protocol, it makes sense. It's simpler for the physician, for the nurse practitioners to protocol, to just give them the protocol for them to take home, except that it doesn't work for everybody.
Right.
But we see that more and more because we call it corporate medicine. Is that right? Is that a correct term for that?
Yes. And like just in our family practice newsletter that comes out every month, they're now saying we're not going to check on whether you have, checking for kidney function. You check your GFR, glomerular filtration rate, for non-African Americans and for African Americans.
Because there's genetic differences.
Right.
Okay.
But they've said, nope, it's not, we don't want to be any type of racism or whatever.
Yeah.
So they now have a new one, eGFR, and it includes everybody. But a lot of doctors are saying, wait, we are throwing out all of the genetics that we learned. And what Alex and I are finding is we've had several people where we were able to go back and look at their genes.
Right.
And they can walk now, or they can see, or they have more energy.
Yeah.
And so algorithms do not take into case anything
individuality.
to do individuality or genes.
So, and that's the problem with one example that I can give you guys was a case that I had last year, and just recently I had this patient as a follow-up. She has a neurological condition, and she told me that she has the best neurologist in town, and she feels very happy with her doctor. She didn't want to change anything, but things were not getting any better. So I had to communicate with her doctor. I sent him an email and I said, listen, I want to ask you, because you've been treating her for a long time, I want to ask you, have you ever done any genetic testing, and do you think that's valid? So basically I got the response of, he said that yes, there is a genetic correlation between where she has in the genetic pathway, but I never talked to her about it, and I never really ordered the test because it's not covered by insurance. And we don't have the clinical trial, the randomized controlled trials to prove to the patient that's what it was. So with his approval, I told her what to do, and she got better. So we just like went above the protocol to educate the patient that that's a possibility, and here's something you can do, and sure enough, she got better. But even though he knew that, he did not mention to her because it's not within the protocol.
Right. And so I think to say to people that listen to this video is this, that just because you've had a lot of doctors say you can't, or you're stuck,
Yeah.
maybe you're depressed, is you're probably going to have to go outside the AMA, American Medical Association approved guidelines.
Yeah.
And that's basically what our practice is.
Yeah.
And if you feel you're getting corporate medicine, try talking to your doctor and just say, no, what other treatments are out there outside of the protocols? Because what's the purpose? For people to get better.
To get better, exactly. Thanks for clarifying. This was very helpful.
We hope you found this helpful in your day-to-day living here in America.